ECT is not a new therapy. It was first used on a patient in Italy in 1938. Doctors place padded electrodes on a patient's temple while they're under anaesthesia and muscle relaxants. Then a series of electrical currents around 60 to 70 pulses and as high as 460 volts are sent for up to 8 seconds to trigger a seizure. The treatment is repeated twice a week, with patients having around 6 to 12 sessions in total. Between 2016 and 2018, just over 5,100 patients were given shocks to the brain, with more than a third of people being given the treatment without consent.
This new development of giving it to people under 18 is extremely worrying. These brains are still developing. There's been no research whatsoever into its efficacy or safety for children. And the managers of the trusts where this is happening need to rein in these psychiatrists immediately and nip this in the bud.
It's not known how many teenagers have been given the treatment, but Dr. Joanna Moncrief says it's worrying that it would even be considered.
We just don't have enough research on what ECT does to the brain, and we certainly don't have enough research about what it does to the developing brain in younger people. We know that it can cause permanent memory loss, which suggests that it may do some permanent damage to some parts of the brain. And we know that the developing brain is much more vulnerable to the side effects of drugs, for example. So it's likely that it will be more vulnerable to the effects of ECT as well. So I think that giving ECT to teenagers and young people is a real worry.